Throughout the years, the American Academy of HIV Medicine and the Institute for Technology in Healthcare have recognized leading practitioners nationwide for their innovative use of technology in caring for people living with HIV. This year, the organizations have given the $20,000 AAHIVM Institute for Technology in Healthcare HIV Practice Award to Dr. Kevin Fiscella of the Anthony Jordan Health Center in Rochester, New York, for his electronic patient health record, Your Health.
Technology really plays a vital role in HIV, and of course many patients living with HIV are socially disadvantaged, and many, particularly the older patients, are on the wrong side of the digital divide. And I think that this award highlights the power of technology, but also the need for the technology to be brought to everybody. U of R Health arose out of a community-based participatory research project that involved patients, HIV clinicians, and community-based organizations from the greater Rochester area. And we were talking about what we could do to enable patient self-management. And the patient said, well, the problem is that's really not secure information. Nobody wants to walk away with a piece of paper. Can we find a way to use electronic technology to secure the data? There are some electronic personal health records that run off of, say, smartphones that are available on the market now. What's unique about ours is it uses the personal data that the patient enters to generate personalized information and prompts to the patient. They have all of their medications, all of their lab tests, all of that available on the device, so they don't need an internet connection in order to access that. If they show up at an emergency or at another visit, they can pull it right up then and there. I think perhaps one of the biggest challenges is making sure that patients who are most disadvantaged both have access to the technology so that they actually have, for example, a smartphone, and ultimately internet access so they can access additional health information through some of the more reputable sites. It's been at least a 5-year process. We began by piloting earlier versions with patients and then getting their feedback. I think this fund will enable this technology to be really spread throughout New York State and hopefully wider. What we've found works best in terms of training is groups of about 8 to 10 that are often co-facilitated by practice staff and a peer who has used this technology in the past and is currently using it. And what we find in these groups is that patients who are perhaps more sophisticated in technology help those who are still learning. And so it's a really powerful tool of bringing patients together, all committed to the same goal, which is improved self-management through technology. Well, it's really inspiring to see patients assume control of their own condition and really come in and ask me really good questions. I've been working in this field really since 1983 or so. And the sophistication of the questions I get from patients has really evolved over time, and I think this technology is really helping to accelerate that process. I view the recognition as a recognition for my team. I see myself as a convener of this, and I really see this as a team effort, and I think certainly myself and all of my team members are very excited to receive the award.
AAHIVM would like to thank the Institute for Technology in Healthcare for their generous support of this award.